We're here with Dr. Sibin Zacharias, a cardiologist, to learn about a new heart procedure. Good morning, Dr. Zacharias. I'm Toya.
Good morning, Sibin.
Thanks
Nice
for
to
joining
meet you.
us today.
Happy to be here.
So, new technology coming to McLaren Macomb.
Yeah. We're real excited. We just started a program where we can replace aortic valves via the groin in a procedure called transcatheter aortic valve replacement, otherwise known as TAVR.
TAVR.
Yep.
Okay, will you tell us a little bit about it?
Yeah, well, the aortic valve is one of the cardiac valves in the heart, and a valve can become diseased over time, so it can become either narrowed or leaky. And traditionally, when a valve became narrowed, that's called severe aortic stenosis.
And what causes that?
There's several causes, but a lot of it is due to just wear and tear on the valve over time.
Okay.
The valve becomes very calcified and narrowed. And when that happens, blood does not pass through that valve as easy as it would like.
I see.
Yeah.
And so TAVR helps it how?
Yeah, so TAVR is a procedure where we actually replace the aortic valve. So in the past, when someone had severe aortic stenosis, which is the valve narrowing, that would require a surgical aortic valve replacement, where the chest is actually opened up. It's open heart surgery, and a new aortic valve is replaced by a cardiac surgeon. However, nowadays we have the technology where we can replace the valve through big IV lines that are placed in the groin, and then placed up inside the heart across the valve that the patient was born with, and we can open up the valve like it's a stent and replace the diseased valve.
That's pretty exciting.
Yeah, it's very exciting. We're really proud. We were the first hospital here in Macomb County to perform TAVR, and we've been doing it now for more than 6 months, and all of our procedures have been very successful.
That's awesome.
Yeah.
People have options, and I'm sure that more people are choosing this option. Or are you presenting the other option?
Yeah, so the guidelines that we practice our day-to-day medicine by have actually changed because the technology is so slick and because patients have done so well with it. It's been around in the States now for a little bit more than 10 years, but more mainstream now in 5 years.
Okay.
And so it is very much a viable option for patients that are deemed to be either intermediate or high risk to have a surgical aortic valve replacement.
Okay. TAVR. Is it something that every cardiologist offers, or is it a procedure that's common among cardiologists, or does it require special training or special understanding?
So TAVR has been more widely available in the States, I would say, in the last 5 or 6 years. And several of the centers here in Southeast Michigan do it. As I mentioned, we were the first in Macomb to actually do it. But there is special training that's involved. That's either done via fellowships, where the physicians are trained to be cardiologists and then structural heart doctors, or we can get training when we're actually in practice by the companies who actually develop the devices. So several of the team members that are on the heart team here at McLaren Macomb, we all received special training after our fellowships, and some of us did it during our fellowships, to be able to evaluate these patients for TAVR, perform the procedure of TAVR, and then take care of our patients afterwards.
Yeah, once again, people can feel very comforted in knowing that more than one set of eyes are watching and are capable of making sure that things are done well.
Yeah, for sure. I think as patients are living longer, as people are living longer, I think the complexity of the cardiac diseases and even other diseases that we're seeing has really increased. And so it's always helpful to have multiple eyes on a specific patient because oftentimes seeing things through a different lens and having multiple opinions, I think, results in the best care for that patient.
Is TAVR widely available?
So the procedure TAVR for aortic valve replacement has been around really mainstream for the last 5 or 6 years, and it's offered at several centers. However, we are the first and only hospital in Macomb County at the current time to be offering TAVR.
That's awesome.
Yeah, we're really excited about it.
So can we talk a little bit more about how a heart valve would fail, or how would someone prevent needing this procedure?
Sure. So that's basically what we're looking for as physicians is the symptoms that may suggest that someone has a heart valve problem. So the classic symptoms for a patient who has aortic stenosis is the development of chest pain, the development of shortness of breath, or passing out. Even symptoms like lightheadedness and dizziness.
Okay.
So a common example that we get is patients who cut their own grass. they can usually do it without a problem, but they've noticed that over the last several months, every time they walk one length of their grass, they get short of breath or they develop chest pain. And then they may have an evaluation that shows that they have severe aortic stenosis.
Okay. And what kind of lifestyle things could a person do to prevent this sort of thing happening?
Well, when a patient has aortic stenosis, which is severe, eventually it can lead to the main pumping chamber of the heart, the left ventricle. That can fail and become weak. So when that happens, the body likes to retain fluid. So lifestyle modifications like staying away from salt, things that make us want to retain water are some of the lifestyle changes that patients can make to really manage the symptoms of aortic stenosis. But the bottom line is it's a narrowed, fixed problem that really needs to be fixed to truly make the patient either feel better or live longer.
Okay.
Yeah.
And do you find that more women than men or vice versa?
The spectrum of disease really is, it's pretty even between men and women.
Okay.
It's more commonly seen as we age, and that's because the most common reason for the valve to be narrowed is just normal wear and tear on the valve, where the valve becomes calcified, and as a result of the calcium just does not want to move and open normally.
And is the procedure a difficult one? Can you, how long will it keep you out of commission, or
Yeah, so the
what's
procedure,
recovery time?
TAVR is a minimally invasive procedure. So by that we mean that we try to do as little to the patient as possible to perform the procedure, and that facilitates really getting them sitting up in a chair quicker and eventually out of the hospital sooner. So the wonderful thing about TAVR is it's not really just one person, it's actually a multidisciplinary team that is really working to not only evaluate the patient, but then to actually treat them and then take care of them after the procedure.
Okay.
So there's a concept of a heart team, and the heart team is made of interventional cardiologists, general cardiologists, imaging specialists, radiologists, a cardiac surgeon, and anesthesiologist as well.
Okay.
So it's truly a multidisciplinary effort to optimally treat our patients.
That's great.
Yeah.
And a person could expect to be back on their feet in what kind of window of time?
Well, it really depends on how bad their disease and what other problems they have. In the best case scenario, we've been sending patients home after 2 days in the hospital.
Oh.
And you can compare that to a patient who may have open heart surgery where they may be in the hospital for about a week. So it's usually a lot quicker to get them out of the hospital.
Okay.
Yeah.
And with this being minimally invasive and a great fix, you know, will people be able to see their quality of life return and go back to functioning like they would have?
Absolutely. So once that narrowing is fixed, in the sense that it's taken away with the new stent valve, then blood is easy. It's easier for blood to leave the heart and really go to the rest of the body. So several of our patients that have come in profoundly with shortness of breath and chest pain, and a few that have actually passed out as a result of that narrowed valve, all of those symptoms have eventually resolved after several months. Wow. So there definitely is a chance for remarkable recoveries and turnarounds.
And I'm sure in a lot of cases, people don't even realize they have a shortness of breath until they have more air.
Yeah.
You
So
know?
that's actually a great point, because one of the cardinal features that we really see with aortic stenosis is, in general, it's a process that happens over time. So when the valve becomes narrowed and calcified, that doesn't happen overnight. It can happen over several years. It actually usually does. So as a result, a patient may not realize that they're having chest pain or shortness of breath because they're compensating and changing their lifestyle. And only after the valve is eventually replaced can they look back and say, you know what, I was really symptomatic, I was more short of breath, I didn't walk up the stairs as much as I would like because I was compensating for the fact that I was short of breath.
Wow.
So that's a really good point.
Well, congratulations on, you know, being able to offer this amazing procedure and give people more options.
Yeah, well, thank you. I think we're particularly lucky at McLaren Macomb because you know, as a smaller community-based hospital, we all the physicians know each other. I think we all work very well together as a team. And as I mentioned, it really is a team effort to not only evaluate these patients beforehand, but to get them treated during the procedure and then after the procedure is done. So I think that's one of the unique perspectives and attributes that we bring
really
to our
comforting
patients. Yeah.
to someone going through something that
absolutely.
could feel really traumatic.
Yeah, absolutely.
So, good stuff.
Good.
Thank you for being here with us today.
Yeah, thanks for having me. It's a pleasure.
Appreciate it.
Thank you.
For more information, visit mclaren.org/Macomb Heart.